When we talk about joint pain at any joint segment, head to toe, the most under-discussed and crucial part of that conversation actually revolves around breathing, specifically the breath's ability to influence rib position and thus spine position and thus the position of all other joints throughout the kinetic chain. So why is that? Well, the first thing we have to understand is the relationship between the diaphragm and the pelvic floor, okay? So first let's start, what is the diaphragm for those of us that don't know? The diaphragm is essentially a parachute-shaped muscle, right? And you can actually find it just below and sort of underneath your rib cage. So if you take a couple fingers, right, and you just kind of press in and up under your bottom ribs, you might feel some tension, some tightness. That's your diaphragm, okay? And what happens when we get a proper full breath cycle is, so upon inhalation, that diaphragm is going to descend down into the abdomen, right? And what it's going to do is it's basically going to, by descending, it's going to open up some space in the lungs and the chest cavity to pull air in. So that diaphragm comes down. With that diaphragm, we have what's called the muscles of the pelvic floor. So pelvic floor muscles are a group of muscles that line the bottom or the bowl of your pelvis, basically. And as that diaphragm descends with inhalation, that pelvic floor forms this kind of tandem effect and comes down with it. So it relaxes and also descends with the diaphragm. As we exhale, that diaphragm ascends and the pelvic floor muscles contract and they come back up with the diaphragm. So we get this kind of piston-like tandem effect between the diaphragm and the pelvic floor. Now, in regular life, okay, for most of us, if not all of us, to varying degrees, what tends to happen is life is stressful, right? Life itself and life in our hectic culture gets stressful. And most of us, again, if not all of us, get locked into what we call a sympathetic state, which is basically an arousal state of the nervous system, right? So sympathetic nervous system, for those of you that don't know, commonly referred to as your fight or flight nervous system. And the sympathetic nervous system is going to be basically, you're activating the sympathetic nervous system on your inhalation, right? So anybody that knows about nervous system states knows that one of the quickest ways to shift out of a sort of high sympathetic or high arousal state, maybe that's anxiety, right? Could be at its most extreme form anxiety, is to do long, slow exhalation. This is commonly taught in breathing techniques from therapists and breathwork practitioners, etc. Long, slow, exaggerated exhalations activate what's called the parasympathetic nervous system, which is also, for those of you who might know, called your rest and digest nervous system commonly, right? So if we're walking around in this sort of tuned up sympathetic drive nervous system state, then we're chronically stuck in essentially a state of inhalation, which effectively means that my diaphragm is always kind of stuck down in my abdomen. I'm never able to fully exhale and thus make my diaphragm ascend, which makes my rib cage come down and in, or what we call caudal. And the pelvic floor then kind of stays stuck with it and tends to get tight and weak. So how does this affect posture throughout the chain? Well, if I'm stuck in this inhalated ribs up state, right? So if my diaphragm is never really able to come up and have those ribs exhale, right? You can kind of see it. If I'm stuck in here, a little exaggerated, my ribs come down and in as I exhale. If I can never get my ribs down, when we look up the chain, consequences this has is, so if you watch my joint by joint video, you might be familiar with the thoracic spine, which is sort of that upper spine area, right? And in a normal thoracic spine, we have a slight curvature, a slight what we call kyphosis, and let's say this is the spine, right? We have this slight curvature to it. We have the scapula, or the shoulder blade, actually also has a slight curvature to its shape, and that allows it to move on this kind of full axis around that just slightly curved thoracic spine. Now, if I'm always in this ribs up sort of inhalated posture all the time, you could probably see really clearly, right? As soon as I come up, bring my ribs up, my spine gets very erect, very straight. Basically gets what we call flat, a flat thoracic spine. And what happens is along that straight or flattened thoracic spine, now that scapula doesn't have full room to glide around its normal axis, right? So it basically runs out of room. And what that essentially equates to is, if the scapula can't move, again, watch my joint by joint approach video for a breakdown of this. Basically, if that scapula can't move, that rotational shoulder joint, which is supposed to have a lot of range of motion, can't express itself fully, can't move fully. And again, in that video you'll watch, and if anybody's ever listened to me, if you have a loss of shoulder mobility, typically it comes out in the wash somewhere in either the neck, could be the elbow, could be the wrist, could be the shoulder itself, right? So that's kind of the consequence up the chain. And then as we look down the chain into the lower extremities, into the pelvis and the hips and the legs, what we see is, again, if my ribs are constantly stuck up, okay, so diaphragm is kind of never able to fully ascend, pelvic floor is always kind of just stuck down with it, right? They're both kind of stuck down here. Pelvic floor can't contract. Pelvic floor contraction has a lot to do with the muscles in your hips, right? Specifically being able to get into your glutes. If we can never actually get out of this, this extension that we also see through our low back when the ribs come up, we get with that, some people might be familiar with what's called lower cross syndrome, or that sort of open scissor posture. It goes by different names, but it's essentially that ribs up, right? So ribs up, and the pelvis kind of dumps forward at the bottom, right? So that sort of butt out, gut out, what we call anterior pelvic tilt for its formal name. When we're stuck in that anteriorly tilted pelvis and that overly extended lower back as well, what we get is we get a pelvis that basically can't tilt and move properly either way. The glutes can't fully fire, and then, of course, just like the shoulder in relationship to the scapula, the hips then lose mobility. When we have a loss of mobility at the hips, we almost always see some type of low back pain, right? We see knee pain. We can see dysfunction down even into the foot, things like flat feet, plantar fasciitis, ankles that don't move so well, and vice versa. The ankles or ankle injuries can feed that as well up the chain. But the point is, when we're talking about this sort of compromised pelvic floor and diaphragm and thus rib position, what we effectively see is nowhere head to toe in the kinetic chain isn't potentially affected. So what I'm going to do in the next video is I'm going to show you guys some tips, tricks, exercises, and whatnot to start to bring yourself back into what we call a more neutral spine and rib position, and thus improve potentially pain at any joint segment. It'll be the foundation. There might be some additional things, but start to improve pain at any joint segment in the kinetic chain, and just start to be actually more efficient in even working certain muscle groups, like we said, like the glutes, like actually the abdominals, and so on and so forth. So stay tuned for the next video.